A sudden surge of coronavirus cases is prompting increased concern from health officials. Joining us now is Dr. Rob Danoff of Jefferson Health. So, Dr. Rob, thank you for joining us.
Good morning.
So let's begin first, sir. Sharp increase all across the area. What are you seeing in Bucks County right now where you run that testing site?
You know, it's the same thing, Jim. The trajectory of cases is going up, so we're seeing more positives. A lot of people may have been exposed to someone else, and we're testing people without symptoms also, and we're showing a lot of positives. There's an area, especially around Ben-Salem area, that seems to be a higher incidence, but any area where there's dense housing, where there's crowded amount of population, it's increasing. So the trajectory is increasing, and it's still early. It's not even winter yet.
And we were expecting this basically because of cold weather. And why is that so?
You know, so cold weather, people get into closed spaces, crowded spaces. It's the three C's actually: cold, crowded, uncovered. So people get together. They're not always wearing their facial coverings, and that makes a big difference. Also, colder air. The virus can live and float longer in colder air. So people can be closer to around other people and get the virus. When it's hot and humid, the particles of the virus sink because the humidity makes them heavy. But this cold air is dry, so that's why if we're close to people, even outside taking close walks, maybe at a community event, we're at higher risk.
So, Dr. Rob, some health experts are projecting the United States could see 20 million cases by Christmas. Are you concerned that hospitals won't be able to keep up with this surge?
We all are. The reason being is because this is the cold and flu season. We are seeing more hospitalizations now for pneumonia, for heart disease, and it's just starting. The winter season tends to be a higher rate of hospitalizations, and it's starting now. Now, combine that with people who are getting sick from COVID, who have to be hospitalized, and yes, it's a big concern. Our hospitals are starting to fill up, as our intensive care units. So it is concern, and that's why everyone pleased with coronavirus. If you can protect yourselves, that would mean a lot, because we're trying to keep people out of the hospitals and healthier and keep them from getting the severe symptoms of COVID.
We got some promising news a couple of days ago about Pfizer's progress on a vaccine. How confident are you in the success of the early trials? And speak about some of the challenges ahead once the vaccine's approved.
They're saying this vaccine may be 90% effective at either preventing the disease or decreasing the severity of symptoms. So the early studies look good. In another 2 weeks, we're going to get some more data points. So it's still early. But, most vaccines, we look for 50 to 60% effective. This one said 90. So we got to see if that's real. But say the vaccine is effective, and they're going to go for emergency use about the 3rd week of November or 4th week to try to get that designation. The trouble is, this vaccine has to be stored at minus 109 degrees Fahrenheit, minus 109 degrees. So shipping it is going to be a challenge. Pfizer, the company that's developing it, has these called thermal packages. They're going to ship them themselves to different areas. But most hospitals and storage facilities do not have these type of refrigeration or freezer units. So that could be a problem, but they'll solve it.
And also there's a case of, not everyone's going to be eligible to get this thing right away. What do you think the average person, the wait for, say, myself or, everybody else, maybe spring?
Yeah, Jim, March, April. For most people, March, April. The initial doses are probably going to go to those highest risk, perhaps nursing homes, first responders, nurses, respiratory therapists, healthcare providers that are right in the faces of people with COVID, taking care of the sickest patients. And then later on, it will be for more people. But initially, it's going to be for the highest risk people, and then they'll go on from there. So for all of us, the general population, the earliest, March, April, where we think there'll be enough distribution and enough vaccine doses.
Dr. Rob, we always appreciate your insight. Happy Thanksgiving in advance, and we'll keep our fingers crossed that people do the smart things here.
Happy Thanksgiving to everyone, and please keep in small groups, wear your face coverings, please. Be safe.
Thank you, sir.